Hi, everyone. I'm here with Dr. Nario. As you know, Dr. Nario is with Biointegrative Health Center in Reno, Nevada. You can check them out online and see all the different things that they treat and what they do there. So thanks for being here, Doctor.
Hi, Steve. Thank you for having me again. Always a pleasure.
All right. So I know you work not only at the clinic, but you also work in another cancer clinic
hmm
and you work closely with them and you also treat some patients in your clinic. You've been out of the country for a while and kind of got corralled by media in other countries to talk about some of this. So, tell us about this new cancer technique. I don't know if it's new or not, but tell us about it.
It's actually not new. It's been in the market for since 2020 or 2022, and it's now gathering some traction. It's actually a technique called superior or supportive oligonucleotide therapy. It's called SOT, and it's made in Greece, and it's something that is now being utilized as, I'm not saying it's a replacement for chemotherapy, radiation. It's an adjunct, and actually has been seen to produce better responses in patients who are actually undergoing cancer therapy, who just got diagnosed with cancer, who has remission or been said to be being trying to maintain as cancer free. So it's for every type of cancer patient out there, not just the ones who actually are inflicted with cancer. And that's why this is a beautiful add-on, because the results are really astounding. Especially now we have our own patient base who we tried it on, and as you mentioned, when I presented this in the Philippines, this is where I got more of the oohs and the ahs from the crowd.
All right. So you said that this can be used for any type of cancer.
That is correct. Any type of cancer. The wonderful thing about this is, even as they claim, that it can actually go to the brain. It's the brain cancers are really the one of the hardest ones to get through, because we have what we call the blood brain barrier. It's almost like a tight net that you can't get through, and that's why it's hard to put medications there and even chemotherapy. And has been noted that this remedy can actually go through that and help with the cancer of the brain.
And this can be used in conjunction with any other type of therapy that someone chooses.
Right. It's not only when I mentioned about chemotherapy, radiation, but also we're talking about natural integrative approaches such as ozone, EBOs, even chelation therapies, even high dose vitamin C, oral supplementation, herbs. And that's why that's the wonderful thing about it. The interaction is not bad. It's actually going to be synergistic and even help the cancer patient overall.
Yeah, I know that, you're getting pretty advanced and been doing this for a while with, more natural and alternative methods of treating cancer.
hmm Right. And that's true. And as I focus on the more of the alternative and supportive part, the conventional side of the therapy of cancer is also something that will benefit from this. And there's so much tedious preparation and details about it. That's definitely something that a lot of the people there, especially doctors, ask me, and how it was prepared, where does it come from, what is it all about. But curious minds in the Philippines.
Now, you said something there when you first started talking about this that I don't know if I quite caught that completely. It's y- this is for people, you said other people that don't currently have cancer. Is it people who've already recovered, or what did you mean by that?
It's not for the ones that does not have cancer. It's for the ones, for example, that had therapy, and these doctors who declares their patients cancer free. So those are the ones that we need to maintain that, so you're not going to be going on the other side of the fence. The reason why I say that is because the sample comes from your blood. So the blood needs to contain circulating cancer cells. If your blood does not have circulating cancer cells, if it's very low in amount, because you have to remember, even normal individuals have cancer cells. Even you and me, And we have at least the number would be one cancer cell per 20 to 25 ml of blood. And the thing here, why we're not manifesting cancer, is because our immune systems are really tight and we're on it. For these cancer patients, these immune systems went down. And that's why we need a sample of that cancer cell, because that's where we're going to be getting this extract of what we call the SOT.
Okay, so this would be someone who maybe after their treatment, they want to stay cancer free after they've been declared cancer free. These are some treatments that are like extra cautious or
Mhm.
extra precaution.
Right. It's maybe you can use it as a term as preventative, rather than even healthy patients should get it. I probably wouldn't suggest that, just because the lab wouldn't find any much amountable cancer cells to get the SOT from.
Okay, so you said that this technique is used, it connects somehow with the blood.
Yes.
So tell us more about how you're using the blood or how you're testing the blood to proceed with the treatment.
Right. So the thing that's involved here is we need to get the blood sample. So they term this as a liquid biopsy, basically. The reason for that is, as I mentioned to you, the circulating cancer cells are there. And when you get, and that's how cancer spreads. We don't like cancer in the blood for the reason that it's always going to find fertile soil, meaning it wants to go to the brain, the heart, the lungs. Once it's there, we need to catch it and put the brakes on it. So when we do the blood draw, we need a good 20 to 25 mils of an amount. And then we send it to the lab. What the lab does is they're going to dissect this cancer cell and make sure they count the circulating cancer cells. And when they actually see so it's all about the DNA. This is called what they're trying to find here is the messenger RNA. So basically, forget about all those terms. What I want to emphasize here is they're going to find that DNA of cancer. In the lab, we'll make a very small molecule that will block this DNA and attach to it to make it not replicate, to make it die so fast, to make it not be viable to grow. And that's how this SOT works. And this is also blood that for sure is going to be um, tested by the lab for other illnesses, making sure that it's when it's going to be returned to you, when they have manufactured that little molecule, they make sure that there's no infection, it's sterile, they went through rigorous testing for it, and it's also being given back as an intravenous infusion back into your system to find now all these cancer cells. And sometimes, again, there are protocols. It's not only one therapy that they would benefit from. This is something that we watch out for and recommend to patients. Hey, you need a little bit more, but we are actually on a right path here. So that's kind of like an overview on how this looks like.
Okay, I just want to make sure all our listeners are understanding this. So it sounds like you're drawing the blood, evaluating it, and you're putting the blood back, but you're making it more so that it's immune and it can find these other cancer cells and block them.
Right. So you that's yeah. I don't think that we're putting the blood back in there. So what they're going to do is it's actually going to be in a very micronized powder form, where these little blockers now are made. This is the cancer DNA, right? And this is the one that we're going to infuse back in, and they're going to attach to that DNA. So these are the guys that the lab are actually trying to extract from your blood sample. So you're going to see a white powdery residue that will come back from the lab, and you will dilute that with infusion solution to now give it back to the patients. It's not actual blood that's going to go back
Okay, so but where does that go? That goes back in the bloodstream, or
in the yes, in the because we're going to inject that in the vein again.
okay,
So it's like
just wanted
heat
to make
seeking
sure.
missiles, right? So it's going to find the targets again once you put it back into the system.
Okay, gotcha. So if you guys have questions, put them in the comment section, or you can look up Biointegrative Health Center. They can call the clinic if they have more questions, because a lot of people, this is pretty fascinating and it sounds like something that could be beneficial for anybody with cancer. Is that right?
Anybody with cancer, may it be whatever stage it's involved. And the good thing about this, we have our actual star patients. We have a stage 4 cancer, like a prostate cancer, who was actually having a lot of spread in the system, and who was on chronic opiates, pain medications, and we gave them this, and this actually removed all that need for pain medication, and of course controlled the spread of the cancer. Is now living a healthy life. I have another one
Wow.
with a large spleen who has lymphoma, and I know her personally, and she is usually a frequent flyer in the emergency room, getting blood transfusions. But with this therapy and combined with other therapies, also, she is now living a normal life as we speak.
And you said, I think you may have said this before we turned the video on, that it's got a 77% positive effect rate,
Mhm.
which means 77% of the people are going to respond positively in some way. Is that what that means?
That is correct. So, in the facility that we are doing this study on, we're actually getting a 77% response with our patient, I mean, positive response. So, there you can define three ways on how you define positive response. One is you stabilize the disease, no progression. Number two, you actually regress the disease, and actually there's no specific progression at all. Or number three, you improve the quality of life of these patients. So this is not only our study. There's an international study that was done on this technique, the SOT technique, and this was also composed of different doctors around the world, and they also came up with a number of 77%. And same for our study as well. That's why it's definitely similar and matching with the international and our local study here.
Okay, so all of you listening, if you're interested in this, reach out to Biointegrative Health Center, and I'm sure you can point them in the right direction, right?
Yeah, definitely, definitely.
Okay, so is there anything that you would add, maybe that I didn't ask, anything that you would add to this that maybe I missed?
Going back to the study, yeah, we are actually arriving nearing almost 200 recipients of this SOT. And also now currently there are other practitioners also that are getting oriented to this technique. It's not known to everybody yet, but hopefully as it gets more traction and better results, it's going to be something really to keep an eye out for. And I'm not saying this is going to replace chemotherapy or radiation, but it's another armamentarium in our pockets to think about what can we do against this dreaded disease called cancer.
Is this something that some insurance companies would possibly pay for?
Oh, so that's a good question. Right now, it's not covered, unfortunately.
Okay.
But hopefully, the technology evolves, and I think the ones who are getting onto this would be, I think, Mayo Clinic is starting to get some interest in starting to do studies on this. But in the future, as we like foresee everything, I think it will be something that will be hopefully granted by insurance to be covered.
That's great because I know that's a big deal to a lot of
Yes,
people.
that's right.
All right, you guys have questions for the doctor. You know what to do. Dr. Nario, thanks for being with us.
Well, Steve, thank you again for having me. As you all know, that our knowledge is your power to better health. And thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.
All right, we'll see you next time, Doc.
Thank you, Steve.